Okay, Mark, back to you momentarily. Thank you very much. You know, a few years back, the American Heart Association released some updated guidelines for ways to take blood pressure and what elevated numbers actually look like and mean.
Yeah, it did not address the issue of high blood pressure for women during and post-pregnancy, which has prompted University of Iowa Healthcare to do further research. KWWL's Danny Miskell spoke with one doctor, and she's live here in the studio to tell us more.
That's right. I spoke with Dr. Donna Santillan about groups of women that are susceptible to high blood pressure. She says 30% of women just here in Iowa have high blood pressure, and nearly 75% of them don't have it under control. So she breaks down more of what those groups of women, their risks are looking like and what it could lead to. 50% of adult women have high blood pressure, and many times their pregnancies reveal it.
There's debate about whether pregnancy kind of unmasks a disease that you would have developed later on. Like if you get pregnant and you get hypertension in pregnancy, that you were probably going to be hypertensive later on in life.
Hypertension during pregnancies is called preeclampsia, and after pregnancies is called eclampsia. It's such a critical time for women to stay on top of their high blood pressure.
Only about half of women will go to their follow-up appointment, especially because you're taking care of a new baby.
Women with high risk of hypertension should also stay away from certain birth controls.
So estrogen that is in some forms of birth control increases your risk for hypertension because it contributes to narrowing the small blood vessels. And it increases your risk for clotting.
Hypertension is also the leading cause of 1 in 5 women to have strokes. But it's not going to be like how you see it in the movies.
For a woman, it could be pain in her jaw.
Women often think high blood pressure is linked to eating too much salt or being overweight. They think they could have done something different to prevent hypertension. But Dr. Santillan addresses this misconception.
Having preeclampsia itself has a lot of different causes to it. You know, there are genetic factors, there are immunologic factors. And so what I don't want is for women to beat themselves up that they somehow caused it or that they could have done something really different.
Now, one useful tip she gave me is this. If you're needing to get your blood pressure checked out, but don't have a physician close by, anyone, not just pregnant women, can stop into a fire station. I spoke with Jason Hernandez, the medical supervisor at Waterloo Fire and Rescue, and he advises that with preeclampsia or eclampsia, call and have them come to you instead. And of course, if you feel that it's something more serious, call 911. Ron, Abby?
All right, Danny, thank you. And to learn more about Dr. Santillan's research, just visit our website, kwwl.com.